Thank you all for joining in. Mayor Hancock is in high demand today. He is wrapping up a call, and then I think that he will be joining us in just a minute or two. That'll also give folks an opportunity to join in via WebEx if they're able to get on. Again, the suggestion, oh, here's the mayor. Here we go. All right.
Hi, Aisha, how are you?
I'm well. How about yourself?
Good.
Good. All right, everyone, let's jump right in. Thank you for joining this live town hall where Mayor Michael B. Hancock and a panel, which includes community partners and Denver city leaders, will be sharing with us today. I am Dr. Aisha Rousseau, and I'll be your moderator this afternoon. Happy to be here with you all. I currently serve as the director of the Denver Division of Disability Rights, which is housed within the Agency for Human Rights and Community Partnerships, which we affectionately call HRCP. For those of you unfamiliar with us, the Division of Disability Rights partners with city agencies to promote equitable access by ensuring compliance with the Americans with Disabilities Act and other policies and procedures affecting people with disabilities. Our staff provides guidance, referrals, technical assistance, architectural plan reviews, and support to the Denver Office of Sign Language Services. In the way of housekeeping today, for anyone joining us who needs to see the sign language interpreters, please go to the upper right hand of your screen where you have 3 view options. Click on the grid view, which looks like a panel of 4 little squares. We also have CART available, and you can find the link for CART and changing to grid view in the chat panel as well. I want to give a special thank you to Will Flowers, the Division of Disability Rights ADA Coordinator and Staff Liaison for the Mayor's Commission for People with Disabilities, and also Teresa Marchetta, Director of Strategic Communications and Media Policy for the Mayor's Office. Both individuals did an exorbitant amount of work behind the scenes and were integral in bringing all the pieces together today to ensure that this town hall came to pass. Our panel today includes none other than, again, our mayor, Michael B. Hancock, Candie Burnham, the executive director of Atlantis Community Incorporated, Crystal Porter and Luis Gomez, representing Denver Human Services, Britta Fisher, the executive director and chief housing officer leading the Denver Office of Housing Stability. And unfortunately, we've had technical difficulties with our representative from RTD at Newburgh, and he won't be able to join us today. But we do have put some things in place where the questions will be able to be presented to him. And when we send the information out, the answers to those questions will be provided. We know from COVID-19 related research that disability alone may not be related to higher risk for getting COVID-19 or having severe illness. People with disabilities are not inherently at higher risk for becoming infected with or having severe illness from COVID-19. However, some people with disabilities might be at a higher risk of infection or severe illness because of their underlying medical conditions. Given that, the mayor felt it was important to have an opportunity to share information with the Denver disability community. So thank you all for joining us today. And with that, please allow me to welcome Mayor Michael B. Hancock.
Dr. Rousseau, thank you very much. And thank you to everyone who has joined us on this webinar or this important conversation. You know what, I want to join Dr. Rousseau in really thanking the Division of Disability Rights at HRCP for the tremendous work they do. I want to celebrate her. I know that she wouldn't do that herself. So let me celebrate Dr. Rousseau, who ever since she joined the city of Denver has really has pushed Denver to the forefront of cities that really is walking its talk when it comes to addressing the community, addressing the issues of our disability community and making sure that we're doing what's necessary to make sure that everyone can live to the fullest extent of their lives and desires in our great city. And so Dr. Rousseau, thank you for your expert and advice and leader and support for our communities in Denver. And I want to second your support for Will Flowers, who cared enough to get this right. And Will, thank you for your leadership. We will continue to seek improvements in communication technology to help provide better access and translation capabilities for all of our residents. Let me say this, I know we had to reschedule this meeting from a previous time, and so I'm glad we were able to make this happen. This town hall meeting is very important to me and to my entire team in the city of Denver, because we know that COVID-19 poses a greater danger to vulnerable populations and people with compromised immune systems. We want to make sure that we do everything we can to address those health concerns and the conditions resulting from COVID-19, and that people have access to the very best services and opportunities to properly combat it, and to make sure that we are aware of whatever resources necessary to help us as a city respond appropriately to all of our communities. So it is important that we listen to your experiences and concerns to better inform our policies and our processes going forward. We don't want to leave anyone behind. This is a city that really truly believes that we're all, and that means everyone. And we want to make sure that everyone's voices are being heard. So thank you for inviting me to be with you this afternoon. I look forward to the conversation. Back to you, Dr. Rousseau.
Thank you, Mayor. Next up, I'd like to introduce Candie Burnham. She's not a stranger to folks here in Denver. She's the Executive Director of Atlantis Community Incorporated. Candie has over 25 years of experience working with the greater Denver metro area community of people with disabilities. She serves on the board of the National Council on Independent Living, and she's also the Executive Director, as earlier stated, of Atlantis Community, an organization with over 45 years of history in the disability rights movement that works to support the rights of people with disabilities to take control over their own lives with full and informed consent, primarily by providing a variety of consumer-led services, from advocacy to education to transitioning people out of nursing homes and into their own apartments and homes. Welcome, Candie, and thank you for joining us today.
Thank you.
Absolutely. Candie, can you share with us a little bit about why this conversation, I mean, your intro says it alone, but can you share with us a little bit about why this conversation is important for you today?
Sure. First, I'd like to thank City and County of Denver for hosting this town hall, and I appreciate the opportunity to present and be part of the panel. Disability rights issues come up all the time. They're always present. What we've noticed is that during this pandemic, those areas of concern have been exacerbated and people are in crisis. And we want an opportunity to share with leaders of our city and of our state and of our country the issues that the disability community is facing.
Wonderful. Thank you, Candie. I think anybody that comes to Denver on day one learns quickly about Atlantis, but for those who might not be familiar, can you give us a little bit of information about your organization and how you all provide services as a nonprofit partner in the Denver community?
Sure. So Atlantis Community is a center for independent living. We serve the greater Denver metro area. We are a disability-led organization, provides advocacy. And as you said, we started the disability rights movement in Colorado 45 years ago. We also founded ADAPT, which is a group of disability rights activists. We were founded on the principle that people should live in their own communities and not in nursing homes. And it is still one of our primary focuses. In addition to advocacy and moving people out of nursing homes, we work with about 2,000 people every year to provide independent living skills training. We serve as a hub for resources, referrals to other partner organizations, and we support youth as they leave high school. We are still providing all of those same services, but as a result of COVID, we've really had to enhance some of our services to better meet the needs of our community. One of the things we've done is hired a disaster preparedness coordinator. This is someone who can really centralize all of our efforts and make sure that we are getting the most up-to-date information that's happening. Things are changing very rapidly, but we also want to make sure that our community gets accurate information timely so that they also know how to respond. And we're partnering with other organizations to try and find some creative and innovative solutions to some of the problems that we're facing. And one of them is a pilot program we're working with some pretty great agencies on. And what that will do is help people move out of nursing facilities and pair them up with people experiencing homelessness who will be as caregivers and help them find sustainable housing.
That's powerful. Thank you, Candie. For those who may not be up on their disability history, I can't help but to give a shameless plug here about, can you make the connection for folks when you say that Atlantis founded ADAPT, what significance ADAPT has to the ADA?
Sure. I wasn't sure how much time I had, so I'll try to make it.
Go for it. It's worth it.
In 1983, ADAPT was formed. A couple years before that, 19 members of Atlantis Community did what we called a bus block. So on the corner of Colfax and Broadway, 19 members, we call them the Gang of 19, blocked the buses in July to demand accessible transportation. There's actually a plaque on the southeast corner of Colfax and Broadway commemorating those 19 individuals. And through the work of that and through the work of ADAPT, it really led to a demand of accessibility across the country and ultimately the passage of the ADA in 1990.
Absolutely. I always love to give folks that history about ADAPT and that it is based in Denver. The light bulbs go off for folks like, oh, wow, who knew? So Denver is integral and ADAPT in disability history for the United States. So thank you for your leadership there.
Thank you.
Next up, I'd like to introduce Britta Fisher, Denver's Chief Housing Officer. Britta Fisher was appointed as the Chief Housing Officer for the City and County of Denver by Mayor Michael Hancock in June of 2018. Britta has been involved in affordable housing in the Denver area since 2000, serving primarily in the nonprofit sector. Thanks for joining with us this afternoon, Britta. And if you would please just share a little bit about why this conversation is important to you.
Absolutely, thank you. So I have gratitude in my heart for many partners in the community who are represented here. I also want to express gratitude to our mayor, Michael B. Hancock, who created the Department of Housing Stability 7 months ago now. And we really encompass the whole spectrum of housing need. And it's clear to most Denverites that there is a real need for affordable housing in our community, and that it can be challenging to find and secure that affordable housing. And so we do everything from housing opportunity, creating and preserving affordable housing, to also helping with homelessness resolution and helping connect people who are in housing crisis to those resources. And undergirding all of that is housing stability, helping to keep people in the homes they're already in. And so that work has been very important. And some of my career here included working on fair housing and working with the Civil Rights Division of the state on how we can improve access for people with disabilities. So it's great to be here with you all.
Thanks, Britta. As you well know, well over 40% of individuals who identify as experiencing homelessness also identify as individuals living with it also identifies people living with disabilities. So we really appreciate you joining us in this conversation today and the work that you do on behalf of the city. Thank you. Also joining us today are two representatives for Denver Human Services, Crystal Porter and Luis Gomez. Crystal manages Denver's Mill Levy program, which funds various assistance programs for Denver residents with intellectual and developmental disabilities, as well as their families and caregivers. Crystal, thank you for joining us. And I'll bounce the same to you. If you'll tell us a little bit about why this conversation is important to you beyond the intro that you've already been given.
Thank you so much, Dr. Rousseau. Can you hear me okay?
Yes.
Great, thank you. Thanks again for having me out this afternoon. I'm really excited to be a part of this panel. The issues that face people in our community that have disabilities are both unique, but also widespread and common to all of us. And so one of the things that my program looks at and supports is how can we, as an entire community, really come together to have the supports we need, the resources we need to be connected, safe, and well. And so this conversation, everything that I've sat in on so far with COVID-19 and the things that our program is currently working on to provide services for individuals with IDD and their families is really about how our needs are maybe the same, but also changing, and looking at some of those needs through the new perspective of the current pandemic and resulting economic crisis. So excited to be a part of this conversation today, and I'm really appreciative to you and Will, as well as Mayor Hancock, for pulling this group together.
Wonderful, thank you. Crystal, I kind of think anecdotally, we've probably emailed each other 1,000 times, but this is the first time I've seen your face. So thanks for joining us today. I really appreciate you.
Thank you.
Also joining us from Denver Human Services is Luis Gomez, DHS's operations manager, whose role includes overseeing the long-term care and Colorado workforce units. Luis, thank you for joining us. And if you'll tell us a little bit about the programs that you oversee and how it specifically relates to individuals living with disabilities.
Hello, yes, thank you for having me on this panel. It's a pleasure. And as others have mentioned, thank you, Mayor, and our director for putting together this panel. Primarily, when it comes to eligibility determination, specifically around financial eligibility, when it comes to our long-term care services, that's primarily the team that I oversee. And we have the shared goal of working with our partners when it comes to our single entry points, ensuring that those services and assistance are secure for individuals who are seeking those long-term care services. It's our task to ensure that those accessibility is there and timely action is taken so that those services are in place when individuals do need them. And that's primarily, I'm hoping that I can answer questions around our eligibility determination, working with our single entry port partners. And when it comes to eligibility, what that looks like if individuals are seeing some, whether it's concerns or just questions around their eligibility, what that looks like during this pandemic. I'm hoping to provide some information around that to ensure everybody feels informed and that we're all in this together and working collaboratively so that everybody feels supported and informed during this time.
Thank you, I appreciate that. A big thank you once again to all of our panelists for joining us this afternoon. So let's jump right in. In preparation for this town hall, the Division of Disability Rights put out a call for questions from the community. And the questions that we're going to pose here today came all directly from community members. Those of you participating online will also have the opportunity to pose direct questions to our panelists in the Q&A section. Any questions that we do not have the opportunity to address live will be recorded and answered after the town hall concludes. Please keep in mind the goal of today's discussion is to ensure that you're well informed on issues surrounding COVID-19 and to get your questions answered. And we know that there are a lot of questions. Having said that, last housekeeping tip, and then I'm going to jump in and toss this to the mayor. Again, for anyone joining who needs to see the sign language interpreters, please go to the upper right hand of your screen where you have 3 view options. Click on the grid view, which looks like a panel of 4 squares. And we also have CART available. You'll also find the link for CART in that same grid panel. So Mayor Hancock, let's start off with you. Can you speak to the city's plans going forward to continue addressing the challenges of this ongoing health crisis, and also how the city is planning now for long-term recovery?
Dr. Rousseau, we've said all along that it was extremely important to us to approach COVID-19 and its presence in our community and its impacts with a very thoughtful lens and one that looks toward the long range. Testing and contact tracing were extremely important to us. We never abandoned that value because we felt that as we begin to open up the economy, that it was very important that we build confidence with our employers and our employees, but also with consumers. As we walk in and out of retail spaces, restaurants, wherever we go, we got to have some sense of confidence that the right steps are being taken to secure safety and health for everyone who goes in and out of spaces. And so we focused on raising our capacity to test people, as well as to begin to trace those who may have come in contact with individuals who tested positive. We have those mechanisms in place right now, and we are growing our ability. And I want to say to everyone who's listening on this web conversation, if you believe that you are, if you're symptomatic today, We have set up a testing site at the Pepsi Center. It's free, it's very quick. All you have to do is go to denvergov.org and to register to come through the site. It'll take you just a matter of a few minutes to get through the line there and get tested. Or you can call 311, but we want to make sure that if you have symptoms and you believe you may have been exposed, that everyone gets tested, and we have that capacity to do it today. It's not that nasty test at the back of your throat anymore. It is just a nasal swab, and it's much more pleasant. Let me just say that. The long-term recovery is extremely important. And about 2 months ago, I appointed an Economic Recovery and Relief Council that now has in excess of 120 people who are working collaboratively to think through every possible scenario on how we as a city begin to recover. The governor just announced yesterday that we can open up restaurants on Wednesday. A month ago, we had the framework in which we would allow our restaurants to open in Denver. And so we're ready to go. Restaurants have applied for waivers to allow them to begin to open. That's the kind of forward thinking we've been trying to do here in Denver. But I'll tell you this, no matter what the industry is, as I said, it's about confidence building on the employers basis as well as the consumers. But we're going to open up our economy in a slow, thoughtful manner with the overriding objective of goal of keeping everyone safe and healthy as we re-enter into our normal workspaces. A lot of people are going to work from home, but that's going to be part of our new reality, new normal, if you will. But it's all about safety.
That's helpful. While we have you here, we've received other questions broadly concerning social distancing and enforcement. If individuals don't necessarily or have questions around wearing face coverings and how the city is expecting businesses and public transportation to enforce mask wearing and social distancing, can you just talk a little bit about that?
Yeah, this was never about creating, getting people arrested or creating a criminal situation for folks. This is about voluntary compliance. And I've said it once, I say it 100 times. When you wear a mask, you're protecting me. And when I wear a mask, I'm protecting you. And we want to encourage everyone to wear a mask. If you leave your home for whatever reason, if you're going into a public space like a restaurant or a grocery store, you're going to be required to wear a mask, wear a face covering, I should say. And if you are walking or if you're taking a stroll or movement around the community, just on a trail or what have you, you don't necessarily are required to wear a mask, but we encourage you to wear a face covering because it is extremely important, again, that we show and demonstrate our commitment to one another, I care enough to want to protect you, and I hope you will do the same for me. The only way we stay on this side of the epi curve is that we all take the steps to wear face coverings, exercise, good sanitation, use hand sanitizer, keep social distancing, physical distancing from each other, particularly when we're not familiar with the people next to us, and be smart and thoughtful, not only for your own good, but for everyone else in your space.
That's helpful. Thank you. I don't know if Hollywood heard your message, but there's an actor, his name is escaping me right now, who came out with this whole campaign today that basically said the same thing. When you wear a mask, I'm showing, when I wear a mask, I'm showing kindness to you. When you wear a mask, you're showing kindness to me. So the message is definitely getting out. So thank you for that.
Dr. Rousseau, I have started to thank people in the grocery store and public space. Yeah. Hey, thank you for wearing a mask. I mean, I don't even, just thank you, because people don't realize what it says to me when you're wearing that mask. And so we strongly encourage people to have a face cover. Absolutely.
Thank you. This next question is for Candie. Candie, from your perspective, what has been most challenging about this crisis for Denver's communities of people living with disabilities? What community supports would you recommend to anyone joining us online or who may not be familiar with all that Denver's disability community has to offer?
Sure. So we conducted a survey of our consumers, and they helped us identify the primary issues. Before I go into those, I want to say that these are not all of the issues. We really had to prioritize what we were going to talk about during the town hall. These are also issues that we've heard through other means, our partner agencies, as well as some of our consumers we've done some direct contact with.
Okay.
One of them is around food insecurity. We know that food prices have increased on average about 2% between March and April of this year. But the average SNAP benefit for a single person is $120 a month. And that has not increased at all to stay in line with the food increase, which means there's a lack of availability of affordable food. We all have been to the grocery stores and all of the shelves are wiped clean, and that makes it really challenging for someone who has on average $120 a month. And you can't buy hot foods with your SNAP benefits. There aren't at this time any grocery store chains that allow online ordering of food with your EBD card. So what that means is you have to rely on somebody else to go and buy your groceries, which is difficult if there's a shortage of attendance, or you have to go into the grocery store yourself and buy the groceries, which is unsafe if you have any underlying health conditions. And then there are issues with transportation, trying to get there and back, that have been exacerbated by the pandemic. The second issue is around lack of housing. So there's a lack of availability of shelters. Shelters that are available are unsafe. It's hard to maintain a distance of 6 feet from one another for individuals who are going to those shelters. The other thing that we're hearing a lot about are sweeps. The CDC has recommended that cities not conduct sweeps during this time, and yet cities continue to do so. And this is a problematic practice any day of the year, but during a pandemic, it's putting people's lives at risk. We know of 2 situations during those sweeps where someone's wheelchair has been taken away during the sweep, which further complicates someone's livelihood. They no longer have mode of transportation to even get around the neighborhood. There's also, we know there's a moratorium on evictions, which has been great. There is some concern about what's going to happen when those that moratorium is lifted and those evictions start to happen. The third priority is nursing homes. We've heard across the country they are unsafe, and we need to figure out how to move people out and into their own homes and make sure they have the necessary support so they can stay in their own homes. In Denver County alone, there have been 283 confirmed cases and 76 people have died. So as I said earlier, we're doing the pilot, but that's just a small pilot program. We're only going to be able to work with a few people. So there has to be more intense and expeditious efforts to get people out of those settings. The fourth area that was identified as mental health services. This is an area where people are feeling really anxious right now. It's a time of crisis. They don't know where they're going to sleep. They don't know where their next meal is going to come from. And they're worried about their health. And it's taking weeks for people to get into mental health supports if they even have access to it in the first place. All of that said, one of the things we know, we acknowledge that we conducted the survey online, and so we were only able to reach those people who have access to technology. Is a huge issue. It's this digital divide in this particular time in our society. Everything is being done remotely, and so if you don't have access to technology, you don't have access to telehealth appointments, so you can't communicate with your physician. You don't have access to telemental health supports. You don't have access to remote substance recovery, so NA or AA. You can't order your groceries online, even if you have other resources beyond SNAP benefits. And so it has really caused further isolation of our community that already experiences a great deal of isolation. These aren't new issues for our community. We have been fighting these systemic issues for decades, but they are absolutely exacerbated because of the current situation we're in.
Mm-hmm. Candie, I thank you for highlighting that and sharing what your specifically the constituency that you've been working with have been highlighting and prioritizing what some of the greatest issues are. I appreciate that. You know, Will and I have both served on or have been serving on or been on the calls with the state's emergency council. And this part that you bring up about the social distancing impacting mental health and well-being is really important and has come up as a pertinent issue time and time again on the calls. Can you talk to us a little bit about the types of peer support that are being offered either by Atlantis or other agencies that you might be aware of in town, so people know that these resources are available?
Sure. So we do a lot of peer support, but we have found it incredibly challenging to move that model from face-to-face to a virtual model. So as we're kind of going through and again, listening to our stakeholders of which groups are important to them, knowing that people are, and so their attention has focused a lot on survival right now and not always on kind of those more peer groups. They're really looking for some more one-on-one supports, and we continue to provide that. So that is the first way we're providing peer support, is just direct contact. We do have 3 online peer support groups we're doing. One is around chronic pain. So individuals who are experiencing that ongoing pain can call in and have that opportunity to talk with people who have shared living experiences. We also have an art group. It gives people an opportunity to kind of just remove yourself from all of the heavy stuff that's going on and have an hour of lightheartedness while you're creating art and relieving some of your stress in a more artistic way. And then we have a youth group of how are we supporting youth, not only as they transition out of high school, which has certainly been a difficult time for many seniors this time of year, but also just as you enter adulthood, it's difficult, but when you're entering adulthood in the middle of a pandemic, what does that look like? Yeah. So those are the 3 we're doing currently.
That's helpful. Thank you. One of the things that we will endeavor to do when we send out these responses is provide links to these particular peer support groups that you're offering, as well as some others. CCDC comes to mind that they've been having some great groups throughout the week. Also, we'll be sharing the link for those who aren't familiar with the services that they have as well. Thank you, Candie. I appreciate that. So for our DHS folks, we know that you all are doing or providing a plethora of services within Denver Human Services. What services is DHS continuing to provide to support the mental health and well-being of the Denver community? Kind of just to add on to the type of peer support for mental health that Candie was describing. Can either of you describe for us what those services look like at Denver Human Services?
Thank you. Thank you for the question, Dr. Rousseau. So I think that at Denver Human Services, meeting people where they are has always been a top priority. And now more than ever, that has to be something that we work into every aspect of the services that we deliver. And so I'm sure Luis could give you a little bit more information about how that maybe is working and the things that we're doing to adapt in some of our other service areas for eligibility and getting people connected to their benefits. But specifically with my program, I mean, one of the things that has always been an important component of our program is that engagement piece and really hearing from our stakeholders what it is that they need and what it is that they think we can do within our program to support people with intellectual and developmental disabilities within our broader disability community here in Denver. So we're still engaging in those groups. I'm still participating in other groups that you've mentioned, including state webinar updates to be able to hear how services are maybe changing from that state level for Medicaid waiver services that people are currently enrolled in and receiving support from, as well as, you know, hearing from different community advisory councils and really any stakeholders welcome to reach out to me and meet with me and talk about some of their challenges. We also accept written public comments to the program. So all of these things help us really see how the needs, I think to Candie's point, she so eloquently kind of outlined issues that our community was already facing and how this pandemic has really compounded those issues and created maybe even a greater divide than existed previously. So all of the things that she mentioned, I think, are on our radar. And in particular, my program is really excited. We're working on the potential for a service provider to train in a model that will help support people with IDD that also are experiencing mental health. We know that that's important now more than ever, as well as, you know, the mental health that is resulting because of this event, right? Some of the reports that we're hearing, or I'm hearing in some of my meetings, are individuals talking about now that the importance of the pandemic has been impressed upon them, their fear of going back out into the community and getting infected, and they think it's dangerous. And so I think there's a lot of education we can do for our community members experiencing that fear and support for those community members experiencing that fear, as well as maybe a broader education to our general community on how they can support their neighbors and friends with disabilities, and how there may be certain needs. For example, if you have a caregiver with you, you know, how does that impact people in line when you're asked to social distance, even if you're in the same household? And so I know that that came up for me when I was out shopping with my sister, and we thought we could stand together. And it was very confusing to realize, oh, just because we live together doesn't mean we can stand together in public. And I think for people where that is a safety issue, that there's more education we can provide to our general community and resources for the individuals and caregivers experiencing those situations.
So Crystal, let me ask you quickly, this question came up from one of our commissioners about how you all what modalities are you all utilizing to go about explaining the dangers of COVID-19 to individuals with intellectual or developmental disabilities, where there may be cognitive concerns there in explaining and not totally alarming someone. Can you briefly just tell us about some of the modalities or processes that you all are using to do that?
I can definitely speak to what I've heard from our other community providers. Our program in particular administers services through contractors that actually do that work in the community. So we're not actually interfacing directly with those individuals, except for in stakeholder meetings. But I've definitely heard, I mean, there is one of our partners, Autism Community Store, which is based out of Aurora, but serves a lot of families in the Denver metro area, has been working on almost like a story book or guided way to kind of walk through talking with a youth or with someone that maybe would have difficulty grasping what's going on with the pandemic now, kind of the essentials and things to know, and how to make wearing a mask less scary, and a lot of things like that that we're all dealing with, but are maybe especially confusing when you don't aren't able to pick up all of the context of what's going on. I think the other thing is, you know, anything that providers can do to kind of show a visual representation of what they're describing is really important. Staying fact-based and keeping positive while focusing on what the things are that can be done to help support health and safety. I know those conversations are tough. One of our advisory council members that I work with closely mentioned in our last public meeting how challenging it was. Like her son, he was so frustrated that he couldn't go out, and he didn't understand why he couldn't go out except for to go for a walk around the block. And that disruption to his routine and activities was really difficult to navigate, which I think goes to the greater concerns that both you and Candie have brought up about mental health, not just of our individuals and people with disabilities, but their caregivers and their family members that are providing support to them as well.
That's helpful. Thank you. Louise, staying in this same line of thinking with Denver Human Services, another question we received concerns people with disabilities potentially losing access to service during the crisis, and how that can impact their eligibility for vital programs such as Health First Colorado. What can people living with disabilities do to make sure they are covered and not losing services? In addition to that, what is DHS doing to prevent negative impact for people who utilize services? We'd love to hear from you on that. That's a really important issue.
Yes, thank you, Dr. Rousseau, for that question. And as Crystal mentioned, our residents' well-being and mental health is important to us, and that goes services provide. When it comes to ongoing benefits, we have worked with our state partners, which they implemented a project that stemmed back to March, where any discontinuance through long-term medical assistance, including long-term services, that would June. And so although there we had in July, the information that we need for long-term care services that was intact for July, but at least we provide that security. Going from March through June, we don't have to worry about the redetermination process. Our state partners were able to help the waiver from our federal partners to prolong those services through this pandemic. We haven't received any further clarification, so it's through June at the moment. And so come July, we may need to reach out to ensure that those redeterminations are processed. But as of now, there shouldn't be any worry about medical assistance and long-term care services being unavailable. We wanted to make sure those were intact throughout this pandemic. Some things that I can say or speak to when it comes to having a smooth transition once this is all over is to keep in mind those notices that come from the state or the city and county of Denver. Please make sure that you're reviewing those when it comes to your benefit determination and indicating what verification may be requested. Please keep those in mind and be aware of that noticing that comes in your mail. You can also check online. Your benefit determination and any noticing is also posted online at colorado.gov/PEAK, which I think most know as our PEAK website. That's where individuals can go and check what their benefit determination is and any upcoming verifications they might do, or just general notices of remains informed during this time. For our new customers, if there may be individuals.
I'm sorry. We're having a little difficulty hearing from you. So if what we'll endeavor to do, you sound a little muffled. What we'll endeavor to do is, as this is a question that we received from several individuals definitely being concerned about benefits, we want to make sure that this is really communicated out clearly and well to folks. We'll make sure that in the Q&A response out from here that we include your response. We really want to make sure that people have the information so their benefits continue on, if that's okay.
And yeah, Dr. Rousseau, I think I can just add a couple of points. I know it was difficult to hear Luis, but I want to make sure that some of the things that he was going to mention are briefly touched on this call today. So one of the things that we're doing in addition to still being available online to access services as well as by phone is we have a new document runner service. And so that if you are a person that doesn't have online access, like we talked about that technology divide or gap, and are unable to kind of go through that eligibility process online and you would like to receive hand delivered paper documents, we do have a service that will do that now and still practice appropriate social distancing, wearing a mask, all of those things to keep you safe and well. And then when you're done filling out that paperwork, you can call us back and we'll come and pick it up. So we have that service available. It's my understanding that specific to the eligibility for services that we're currently receiving instruction that the stimulus checks that people are receiving will not be included as part of income eligibility. So it's held kind of separate from that, so it doesn't have an impact on someone's eligibility to access the service if they did receive a stimulus check. And finally, our services that help protect children as well as adults are still up and running. They're practicing safe social distancing and doing the work needed whenever something comes up. So those reports are still being taken. And if anybody has someone that they're concerned about, that believe to be at risk, whether it's an adult or a child in the community, you can call our hotline. We have 720-944-4DHS, and I'll provide that to you so you can send that out with the notes.
Thank you. That's helpful. Really appreciate that. Returning to you quickly, Mayor Hancock, given how challenging this crisis has been on employers and employees, we've heard time and time again, the number of Denver residents living with disabilities who may be on a fixed income or employed in industries negatively impacted by the crisis. I know an announcement came out today talking about services that are resources that are available for individuals around food. If you could talk a little bit about any resources that the city is availing in reference to bills or rent or food resources, that would be helpful.
I appreciate that, Dr. Rousseau. And I'm going to invite Britta Fisher to join with me in this because she, as our Chief Housing Officer, can really talk about the services that we have. But one of the programs that we're very, very proud of is our TRUA program, TRUA, the Temporary Rental Utility Assistance Program that you can access through our website as well as by calling 311. But that's where we provide households with assistance if they run into a temporary challenge with regards to rent or, and we're working on the mortgage side. Britta may have more of an update. In terms of the food side, and I'm glad that the announcement was made today, one of the things that we know we have to focus on, had to focus on during this challenge is food. People have run into challenges. You might recall, and it seems like eons ago, and Britta, you can come in after this, is you might recall that the first thing to close, if you recall, were schools. And the first concern people had was, what about those children who depend on their school for their only meal for the day, or only meals for the day? And DPS stepped up in partnership with the city. We were proud to partner with DPS and our rec centers to make sure that grab and go was still available for those families. And so I'm glad we were on this from day one with regards to equity. I'd like to yield to Britta to give a more detailed description or around the housing side.
Thank you, Mr. Mayor. We were fortunate that we started with $2 million in our TRUA program, the Temporary Rental and Utility Assistance Program that the mayor spoke about. However, our applications are up well over 600%. And so we see tremendous demand. And so we were last week to announce that from the coronavirus relief funds that we will be putting forward another $4 million into the TRUA program, except it will be a coronavirus related one. So it'll be an additional program and an infusion of dollars for similar services related to people's loss of income due to coronavirus. We will also do that for mortgage assistance for $1 million. And then we also put $1.5 million into rehousing strategy for people experiencing homelessness.
That's really helpful, Britta. I appreciate that information. That's really great information. We will definitely make sure that that's included in the information that we send out. That's wonderful. To speak to Candie's question earlier, can you tell us a little bit about, and truly, I'm just teeing up the question because we have been in the emergency center enough together. We know that for individuals experiencing homelessness, there are issues, the issues surrounding that have been ever present on our mind in the emergency center. Can you tell us a little bit about the city's efforts to address the impact of this crisis specifically for individuals experiencing homelessness?
Yeah, thank you, Dr. Rousseau, and thanks for being with me in the bunker, the windowless bunker that we're normally in for the Emergency Operations Center. It's nice to see daylight. Yeah, it has been a central factor. And, you know, I'm once again, grateful to have our mayor who leads with an equity lens and an equity platform that says we need to consider those who have the least resources in an emergency and put that front and center. So I really appreciate that. Some of the first things that we did were work with our homeless service providers. As you all know by now, you know, this particular virus and pandemic has put tremendous strain on our sheltering system and for our providers who are used to working on basically a model where we're getting more people into a space, and we've had to quickly adjust and to get more space. And that took a lot of daily collaboration with those service providers, as well as providing support to them. And so we requested emergency resources to do that work. And I could spend more than the next 7 minutes that we have on this going through all those strategies, but I'll touch briefly on a couple of the notable ones. One, we do have auxiliary shelters that have more than 1,000 beds of capacity over hundreds of thousands of square feet. So every person has at least 60 square feet just to themselves for sleeping space, and then many more square feet and room for spreading out for meals and communal time. I think one of the other things that was really impressive in all of this was that we quickly pivoted to 24/7 sheltering. That is a strategy that we've had for a 3-year shelter plan, and we did it in a matter of weeks. And that took tremendous lift by many partners, finding new partners like event venues that would host these resources, and so many providers working together. And that was really heartening to see in a very difficult time. And then I would say the hotel strategy as well, to put up now over 800 rooms for protective action and activated respite, which are allowable uses for FEMA funds. And so we've been able to get that together. And I think you have another question about that too.
Yeah, I do. I wanted to ask you, can you elaborate for us a little bit? I think in Candie's question, she highlighted that individuals may not feel safe in shelters or on the street, or they may be positive with COVID or suspect that they have COVID. Can you talk a little bit about how you all address those needs for folks who are experiencing homelessness? You guys have a great plan in place, so just if you just share a little bit about that with us.
Yeah, I think what's important to a person-centered approach and a trauma-informed approach is to realize that everyone brings their own traumas, and we can't necessarily judge and know the things that make any one person feel safe. And so we've done as much as possible with security, space, really good meals. The auxiliary shelter guests have reported feeling very well rested because they have assigned beds, secure storage, and that they're less anxious and well rested. And frankly, good food goes a long way. But you know, at the end of the day, there are still traumas that make it hard for someone to enter a congregate setting. And we've always been a housing first city. We try to get as many housing resources, but we, as many know, have a mismatch between the amount of housing and the amount of need. And so we continue to address that every day, building more housing, also working on programs to help people access housing, rapid rehousing, rapid resolution, where people can quickly bounce back and maybe not have to enter the sheltering system. But the numbers are apparent that we haven't gotten to everyone. That doesn't mean we stop endeavoring to be person first and trauma informed in what we do.
And if you could highlight for us just a little bit, you spoke about the hotel industry and over 800 rooms. That's a really impressive number. I know the question has continued to come up about how Denver is partnering with hotels, and even why more hotels haven't come on board. Can you just kind of speak to us a little bit about how the partnerships work with the hotels here in Denver?
Yeah, I mean, in the first days of this emergency, you might imagine I was spending almost all my time talking to hotel managers, and it's been complex, more complex than even I, who have been through a lot of contracts. When you add a pandemic on top of anything, it makes almost nothing easier. And I would say there have been several themes as to what has been a struggle. At first, it was we had many hotel managers that were interested in working with us, but not necessarily the ownership. And so every time that we would get closer to decisions, we would find more barriers, whether that was insurance, liabilities, and other things that eventually, if somebody can't get insurance from their carrier for this type of use, it makes it really difficult. I have been continuing to negotiate one contract now for 10 weeks. So, you know, it's just a lot of layers, but I would also boil it down to some pretty simple things. Like, it's also difficult to staff, you know, in order to make sure that we have appropriate supports for people in the rooms. We have had medical care and general shelter support, case management that we have also endeavored to provide. And it is difficult to do that in all the different locations around the city as well, since some of the organizations are located closer to the downtown core. So there's been a myriad of challenges, but I would say overall, when I speak to our peer cities, they're pretty impressed that we've gotten to 800, and we endeavor to utilize those as best we can within the guidelines.
That's wonderful. Thank you. And again, as I shared earlier, you know, the overlap of individuals experiencing homelessness and those living with disabilities, direct correlation. So the work is definitely pertinent and well needed. And thank you for your continued work with the city on this. In these final few moments, I'd like to note that any questions that did not get addressed today, whether provided in advance or through the Q&A, will be answered after this event and published on denvergov.org and also through the Disability Rights website. This event has been recorded and will be available for individuals to watch later and share with anyone who was not able to attend. I'd like to thank everyone for participating. And before we end the event, I, of course, would like to give our mayor the opportunity for any closing thoughts or remarks.
Dr. Rousseau, once again, thank you to Will Flowers. Thank you, and to the Division of Disabilities. Thank you very much for your continued leadership and what you all are doing to help bridge the gap and to make sure that persons living with disabilities have the resources and access to those resources in our city. This is extremely important because they're worth and they matter. And I want to thank you for making sure we have this venue. I appreciate the panel for everything you've said today. Thank you for bringing those resources forward and for meaningfully participating here. Let's do this again. This is important. But let me encourage everyone again, wear face coverings, practice social distancing, physical distancing, and make sure that we practice good sanitation. Wash your hands regularly, use sanitizer as much as you can, and let's stay safe and let's stay healthy out there. God bless everyone.
Thank you. Well, thanks to everyone. We will continue to update individuals. Denver Gov will continue to have information, and the Disability Rights Listserv, if you're not on it, it's disability access at denvergov.org. We'll also include that in the chat. We will continue to send out any press releases and updates to the disability community. Thank everyone for their time, for the partners from Atlantis, and also from city partners, Office of Housing Stability, Denver Human Services, and Human Rights Community Partnerships. Thank you all. We greatly appreciate you all. Stay safe and have a great evening.